Welcome to a new session on the course School Organization, Administration and Management. In this present session, we will have a discussion on topics like osteoporosis, coronary heart disease and back pain. This is a continuation of the previous part, hypokinetic diseases. First, we will have a discussion on osteoporosis. Osteoporosis is a condition of fragile bone with an increased susceptibility to fracture. Osteoporosis weakens bone and increases risk of bones breaking. Bone mass decreases after 35 years of age and bone loss occurs more rapidly in women after menopause. Osteoporosis is a condition characterized by a decrease in the density of bone, decreasing its strength and resulting in fragile bones. Osteoporosis literally leads to abnormally absorbent bone that is compressible like a sponge. This disorder of the skeleton weakens the bone and results in frequent fractures in the bones. Osteopenia by definition is a condition of bone that is slightly less dense than normal bone but not to the degree of bone in osteoporosis. Normal bone is composed of protein, collagen and calcium, all of which give bone its strength. Bones that are affected by osteoporosis can break or fracture with relatively minor injury that normally would not cause a bone to fracture. The fracture can be either in the form of cracking or collapsing. The spine, hips, ribs and wrists are common areas of bone fractures from osteoporosis, although osteoporosis related fractures can occur in almost any skeletal bone. Key risks for osteoporosis include genetics, lack of exercise, lack of calcium and vitamin D, personal history of fractures as an adult, cigarette smoking, excessive alcohol consumption, history of rheumatoid arthritis, low body weight and family history of osteoporosis. A person is often not aware about osteoporosis until a fracture occurs. But there are occasionally symptoms of the disorder, and they are backache, a gradual loss of height and an accompanying stooped posture, fracture of the spine, wrist or hip. Osteoporosis treatment and prevention measures for optimal health of the bone are lifestyle changes including quitting cigarette smoking, limiting excessive alcohol intake, exercising regularly and consuming a balanced diet with adequate calcium and vitamin D. Medications that stop bone loss and increase bone strength such as alendronate or Fosamax, risdronate or Actonel, raloxifene or Elevista, ibadronate or Boniva, calcitonin or Calcimar, zoledronate or Reclast and denosumab or Prolia. Medications that increase bone formation such as teriparatide or Forteo. Adequate intake of calcium and vitamin D are important foundations for maintaining bone density and strength. Estrogen hormone therapy after menopause has shown to prevent bone loss, increase bone density and prevent bone fractures. Lifestyle prevention of osteoporosis is in many aspects the inverse of the potentially modifiable risk factors. As tobacco smoking and high alcohol intake have been linked with osteoporosis, smoking cessation and moderation of alcohol intake are commonly recommended as ways to help prevent it. The diet must ensure optimal calcium intake and measuring vitamin D levels is recommended, and to take specific supplements if necessary. Vitamin K deficiency is also a risk factor for osteoporotic fractures. Weight-bearing endurance exercise or exercises to strengthen muscles improve bone strength in those with osteoporosis. Aerobics, weight-bearing and resistance exercises all maintain or increase bone mineral density or BMD in postmenopausal women. Next, we shall discuss on coronary heart disease. Coronary artery disease or CAD, also known as ischemic heart disease or IHD, is a group of disease that includes unstable angina, myocardial infarction and sudden cardiac death. It is within the groups of cardiovascular disease of which it is the most common type. A common symptom is chest pain or discomfort which may travel into the shoulder, arm, back, neck or jaw. Occasionally, it may feel like heartburn. Usually, symptoms occur with exercise or emotional stress, last less than a few minutes and get better with rest. Shortness of breath may also occur and sometimes no symptoms are present. The first sign is occasionally a heart attack. Other complications include heart failure or an irregular heartbeat. The risk factors for coronary heart diseases are smoking, high blood pressure, high blood cholesterol, diabetes, being physically inactive, depression, being overweight or obese, family history of heart disease, ethnic background, sex. Men are more likely to develop CHD at an earlier age than women. Age. The older you are, the more likely you are to develop CHD. How does coronary artery disease develop? From a young age, plaque starts to go into your blood vessel walls. As you get older, the plaque builds up. That inflames the walls and raises the risk of blood clots and heart attacks. The plaque makes the inner walls of your blood vessels sticky. Then other things like inflammatory cells, lipoproteins and calcium travel into your bloodstream and mix with the plaque. As more of these inflammatory cells join in, along with cholesterol, the plaque increases, both pushing the artery walls outward and growing inward. That makes the vessels narrower. Eventually, a narrowed coronary artery may develop new blood vessels that go around the blockage to get blood to the heart. However, if you are pushing yourself or stressed, the new arteries may not be able to bring enough oxygen-rich blood to the heart muscle. In some cases, when plaque ruptures, blood clot may block blood supply to the heart muscle. This causes a heart attack. If a blood vessel to the brain is blocked, usually from a blood clot, an ischemic stroke can happen. If a blood vessel within the brain bursts, most likely as a result of uncontrolled hypertension or high blood pressure, a hemorrhagic stroke can result. Studies have found that taking low-dose aspirin each day may help prevent heart attacks and strokes in people who are 50 or older and at risk for heart disease. Diagnosing coronary heart disease. A number of tests may help with diagnosis, which include electrocardiogram, cardiac stress testing, coronary computed tomographic angiography, coronary angiogram. Prevention is by eating a healthy diet, regular exercise, maintaining a healthy weight and not smoking. Sometimes medication for diabetes, high cholesterol or high blood pressure is also used. Here we shall have a discussion on back pain. Back pain is a pain felt in the low or upper back. The degree of back pain may be acute, subacute or chronic depending on the duration. The pain may be characterized as a dull ache, shooting or piercing pain, or a burning sensation. The causes of pain in the low and upper back include conditions affecting the bone spine, discs between the vertebrae, ligaments around the spine and discs, spinal inflammation, spinal cord nerves, muscles, internal organs of the pelvis, chest and abdomen, tumors and the skin. The pain may radiate into the arms and hands as well as the legs or feet and may include paresthesia, weakness or numbness in the legs and arms. The pain may originate from the muscles, nerves, bones, joints, or such as the gallbladder and pancreas may also cause referred pain in the back. The causes for back pain are muscle or ligament strain, bulging or ruptured discs, arthritis, skeletal irregularities, and osteoporosis. There are tons of treatments aimed at alleviating back pain like yoga, massage, and acupuncture, medications like antidepressants, muscle relaxants, etc., exercise and diet. The back is a complex structure made up of 33 vertebrae, over 30 muscles, numerous ligaments, multiple joints, and intervertebral discs. Let us see the different types of back pains and its causes. First is a muscular strain. The most common cause of back pain is due to muscular strains. This happens when an unexpected force, a twist or pull is applied to one or several of the muscles in the back. As a result, several tears occur in the muscle. These muscular tears cause pain felt in the back. Next is ligamentous sprains, and this occurs when the ligaments of the back are stretched beyond their means. Next is spinal stenosis. It occurs more commonly in people over 50 years old. The term refers to a narrowing of the spinal canal. Spinal stenosis has many causes including thickened ligaments along the spinal canal, bony spurs, and enlarged joint cartilage from arthritic changes. Next is osteoporosis. This occurs especially in women. It is a disease characterized by progressive loss of bone density. This results in thinning of bone tissue, making one more susceptible to fractures or broken bones. The bones of the spine are specially affected in this disorder. Injury from falls, lifting of heavy objects, or even the force of sneezing can result in painful vertebral compression fractures. Next is fibromyalgia. It is a rheumatic condition characterized by widespread soft tissue pain, fatigue, sleep disturbance, and the presence of evenly distributed areas of tenderness. A history of at least 3 months of widespread pain and tenderness in 11 or more of the 18 designated tender point sites is required in diagnosing this disorder. Now let us see the symptoms. The large nerve roots in the low back that to the legs may be irritated. The smaller nerves that supply the low back may be irritated. The large paired lower back muscles or erector spine may be strained. The bones, ligaments or joints may be damaged. An intervertebral disc may be degenerating. Prevention. Bend knees and keep back straight. Don't bend at waist. Keep the object close. The farther away one holds it from the body, the more it stresses the back. Never hold an item higher than armpit or lower than knees. Don't move something that weighs more than 20% of one's body weight. Don't pivot twist or turn while lifting. Point feet at the items we are lifting and face it as we pick it up. Change direction with feet, not waist. The role of exercise in the prevention, management and treatment of hypokinetic diseases. Exercise reduces the risk of hypokinetic diseases by preventing or delaying the onset of manifestation of the signs and symptoms in individuals. Regular exercise improves the physical fitness of individual, thereby improving the body immunity to hypokinetic diseases. Exercise helps to increase energy expenditure, especially for individuals who expended relatively moderate levels of energy. Research shows that exercise also helps avoid illness such as obesity, stroke, specific cancers, non-insulin dependent diabetes, osteoporosis and obstructive pulmonary diseases. Exercise reduces the risk of dying prematurely. Exercise reduces the risk of developing high blood pressure. Exercise controls weight. Exercise builds and maintains healthy bones, muscles and joints. Exercise helps older adults become stronger and better able to move without falling. Exercise promotes psychological well-being. Exercise helps in the management and treatment of individuals whose movement patterns are disturbed by stroke or any other hypokinetic diseases during rehabilitation and therapeutic stages. Let us now summarize what we have just discussed. Osteoporosis is a disease in which bones become fragile and are more likely to break. If not prevented or if left untreated, osteoporosis can progress painlessly until a bone breaks. This breaking of bones, also known as fractures, occurs typically in the hip, spine and wrist. Any bone can be affected. Coronary heart disease is a narrowing or blockage of the coronary arteries, usually caused by arteriosclerosis. Arteriosclerosis is the buildup of cholesterol and fatty deposits on the inner walls of the arteries. Back pain usually originates from the muscles, nerves, bones, joints or other structures in the spine. And exercise has a major role in the prevention and management of these diseases. Thank you for watching this session on hypokinetic diseases part 2. See you again with a new topic. Till then, goodbye.